Are you wondering if you may be pregnant and looking for early signs to watch out for? As a mother-to-be, it's natural to want to know what to expect during early pregnancy. In this video, we'll be discussing the top 10 early signs of pregnancy that you may experience in the first few weeks after conception. As the host of the Mother of Moms channel, dedicated to fertility, pregnancy, and motherhood, I understand how important it is to be aware of the early signs of pregnancy. Knowing what to expect can help you better prepare for the physical and emotional changes that come with pregnancy. So if you're ready to learn about the top 10 early signs of pregnancy, let's get started. Number 1. Missed period. A missed period is often the first and most obvious sign of pregnancy. If you have a regular menstrual cycle and you have missed a period, it's a strong indication that you may be pregnant. However, it's important to note that there are other reasons why you might miss a period, such as stress, weight changes, or certain medications. If you have missed a period and suspect that you might be pregnant, it's important to take a pregnancy test to confirm your suspicions. Pregnancy tests work by detecting the hormone human chorionic gonadotropin, CG, in your urine. This hormone is produced by the cells that will eventually form the placenta, which is why it is present in pregnant women. Number 2. Nausea. Nausea, and vomiting to a lesser extent, is a common early sign of pregnancy, and it's often referred to as morning sickness. However, the term can be misleading because it can happen at any time of the day, not just in the morning. The exact cause of nausea during pregnancy is not fully understood, but it is believed to be related to the rapid hormonal changes that occur in a woman's body during early pregnancy. Specifically, the increase in estrogen and progesterone can cause the stomach to empty more slowly and lead to a buildup of stomach acids, which can cause nausea. While not all pregnant women experience nausea, it's estimated that around 50 to 90% of pregnant women do experience some degree of nausea during their pregnancy. In most cases, the nausea is mild and doesn't require treatment, but in more severe cases, medication may be prescribed. Number 3. Fatigue. Fatigue is a common symptom of early pregnancy, and many women report feeling more tired than usual during the first few weeks of pregnancy. The exact cause of this fatigue is not entirely clear, but it is believed to be related to the hormonal changes that occur in the body during early pregnancy. The hormone progesterone, which is produced in higher levels during pregnancy, can cause drowsiness and make it more difficult to stay awake. Additionally, the body is working hard to support the growth and development of the fetus, which can also contribute to feelings of tiredness. While fatigue is a common symptom of early pregnancy, it's important to note that it can also be caused by other factors such as stress, lack of sleep, or anemia. If you're experiencing persistent fatigue, it's important to talk to your healthcare provider to rule out any other underlying causes. Number 4. Breast changes. Breast changes are a common early sign of pregnancy. The hormones estrogen and progesterone, which increase during pregnancy, can cause changes in the breasts that can be noticeable as early as a few weeks after conception. One of the most common breast changes during early pregnancy is tenderness or soreness. Many women report feeling a sensation of fullness or heaviness in their breasts, and they may also experience sensitivity to touch or pressure. Another common breast change during pregnancy is enlargement. As the milk ducts in the breasts grow and stretch, the breasts may become larger and more full. The nipples may also become darker and more prominent, and some women may notice small bumps around the areola called Montgomery's tubercles. While breast changes can be a sign of pregnancy, they can also be caused by other factors such as hormonal changes during the menstrual cycle or the use of certain medications. If you're experiencing breast changes and suspect that you might be pregnant, it's important to take a pregnancy test to confirm your suspicions. Number 5. Mood swings. Changes in mood or emotional state are a common early sign of pregnancy. During early pregnancy, the body undergoes significant hormonal changes, which can affect a woman's mood and emotions. One of the hormones that increases during pregnancy is progesterone, which can have a calming effect on the body. However, the fluctuation of hormones during early pregnancy can also lead to mood swings, anxiety, irritability, and even depression in some women. It's important to note that mood changes can also be caused by other factors such as stress, lack of sleep, or pre-existing mental health conditions. If you're experiencing persistent mood changes or emotional distress, it's important to talk to your healthcare provider to rule out any other underlying causes. Number 6. Food aversions or cravings. Number 6 on our list of early pregnancy signs is food aversions or cravings. Many women report changes in their appetite during early pregnancy, often experiencing strong aversions to certain foods or cravings for others. The exact cause of these changes in appetite is not fully understood, but it is believed to be related to the hormonal changes that occur during early pregnancy. The hormone progesterone, in particular, can affect the sense of smell and taste, which may lead to aversions or cravings for certain foods. Food aversions are common during early pregnancy, and many women report feeling repulsed by foods that they previously enjoyed. Conversely, some women may experience intense cravings for specific foods, such as pickles or ice cream. While food aversions and cravings can be a sign of pregnancy, they can also be caused by other factors, such as stress or changes in the diet. If you're experiencing changes in appetite and suspect that you might be pregnant, it's important to take a pregnancy test to confirm your suspicions. Number 7. Frequent urination. Frequent urination is a common early sign of pregnancy. As early as a few weeks after conception, the body begins to produce the hormone human chorionic gonadotropin, THD, which can cause the bladder to fill up more quickly. Additionally, as the uterus begins to grow and put pressure on the bladder, pregnant women may experience the need to urinate more frequently. This can be especially noticeable at night when the body is at rest. It's worth noting that while frequent urination can be a sign of pregnancy, it can also be caused by other factors such as urinary tract infections, diabetes, or an overactive bladder. If you're experiencing persistent or painful urination, it's important to talk to your healthcare provider to rule out any other underlying causes. Number 8. Headaches. Headaches are another common early sign of pregnancy. Hormonal changes during pregnancy can cause an increase in blood volume and changes in blood pressure, which can trigger headaches. Additionally, as the body adjusts to the changes of pregnancy, stress and tension in the muscles and joints can also contribute to headaches. Women who experience migraines may find that their symptoms improve or worsen during pregnancy. While headaches are a common symptom of pregnancy, it's important to talk to your healthcare provider if you experience persistent or severe headaches, as they can sometimes be a sign of more serious conditions such as preeclampsia. Number 9. Dizziness. Dizziness is a common early sign of pregnancy. It can be caused by a number of factors related to the changes happening in the body during early pregnancy. One of the most common causes of dizziness during pregnancy is a drop in blood pressure, which can be caused by hormonal changes and increased blood volume. This drop in blood pressure can cause a feeling of lightheadedness or dizziness, especially when standing up quickly or after prolonged periods of sitting or standing. In addition to changes in blood pressure, dizziness during pregnancy can also be caused by dehydration, low blood sugar, and changes in the inner ear. Some women may also experience dizziness due to anxiety or stress related to the changes happening in their bodies. While dizziness is a common symptom of early pregnancy, it's important to talk to your healthcare provider if you experience persistent or severe dizziness, as it can sometimes be a sign of more serious conditions such as anemia or gestational diabetes. Number 10. Cramping. One of the most common causes of cramping during early pregnancy is implantation. As the fertilized egg implants in the uterine lining, it can cause mild cramping or spotting. This typically occurs around 6 to 12 days after conception. In addition to implantation, cramping during early pregnancy can also be caused by hormonal changes and the stretching and growing of the uterus and other pelvic organs to accommodate the developing fetus. Some women may also experience cramping due to constipation, gas, or other digestive issues. While mild cramping is a common symptom of early pregnancy, it's important to talk to your healthcare provider if you experience persistent or severe cramping, as it can sometimes be a sign of more serious conditions such as an ectopic pregnancy or miscarriage. So there you have it, the top 10 early pregnancy signs. Remember, every woman is different, and some may experience more or fewer symptoms than others. If you think you might be pregnant, it's important to take a pregnancy test and consult with your healthcare provider. Thanks for watching, and don't forget to subscribe to Mother of Moms for more videos about fertility, pregnancy, and motherhood.